On this road, many have lived, fought, and died. This area is filled with activism and pride. But today, there is a new fight with things that like to hide. Particulate matter and nitrogen dioxide.
Around this area, we actually are in the bottom 20% for car ownership, but we're in the top 20% for experiences and levels of pollution. Do you think that's fair?
Of course it's not fair. It's totally not fair. You know, most of these vehicles that use diesel are carcinogenic, that's a fact. So less vehicles, less health problems.
I'm Mark Ashworth. I'm Reader in Primary Care here at King's College London, and I've been a GP for 30 years in the patch. We know already that air pollution is a significant cause of serious illness, and we were able to study every single day over a 5-year period, and on each of those days see what happens to the air pollution levels, see what happens to how many people are seeing their GP with their asthma, with their respiratory problems. Already the data is showing each time the air pollution level goes up, more people are seeing their GPs, and particularly in two vulnerable groups. It's the children who come along with respiratory illnesses, and that's likely to be mostly asthma. It's the elderly, and that's likely to be mostly the COPD side of things. Why do we have this air pollution? And it's so clear. A lot of it in this area is going to be about traffic, it's going to be about lorries and cars and exhausts, and largely it's diesel pollution.
This is our machine here that we're using today. It measures the amount of particulate matter that's in the air at the moment. Air pollution is influenced by various factors like transport and the weather. And every time a car goes by or a truck, the reading goes up from 17 to 41. See?
Oh, wow.
Yeah, what are your thoughts on that?
Quite scary because I live locally. I'm just like over there, so.
That's why we get sick a lot, isn't it? That is why we get sick a lot indeed.
Scary, you need to do something about it.
There are different ideas to reduce air pollution and help people to walk, cycle and use the buses. The most effective way to help people walk, cycle and use the buses is for the Railton area to be access only for vehicles. One way of complementing these would be to introduce electric car, van and bike sharing. Once people are using the scheme, the area would become a zero emissions zone. Once electric cars are more common and the traffic increases, the through traffic would need to be limited.
I think that's a good idea, but I think if it's between one or the other, I'd say the first one, because I don't know what the statistic is now with the ownership of electric cars. I think people are still using diesel and petrol or whatever, so I think if it's one or the other, I mean both, yeah, that would be great.
Now, with all this, what do you have to say?
Join the conversation and shape these ideas.